Hey everyone, good afternoon and welcome back. This is our fifth Facebook Live podcast about domestic violence. Thank you again for joining us. I'm Jennifer Blum, founder and director of the Help Save Foundation, and I am again here with Sherry Petapass, licensed independent clinical social worker. As we do every week, I want to start by giving you the most important phone numbers, the emergency numbers. The domestic violence hotline number is 1-800-799-7233, or you can text HOME to 741-741. And of course, in case of emergency, please dial 911. And in addition, you can also reach out to both Sherry and I at the Help Save Foundation, which is website-wise, thehelpsavefoundation.org. And you just go to contact us, and you can also reach us through our Facebook page, the Help Save Foundation. So we're going to do a brief recap of last week's podcast. Last week we talked about DCF's involvement once a victim comes forward. We also talked about the importance of being supportive to your case and advocating for your case as far as DCF is concerned. And most importantly, understanding that DCF's main focus is to make sure that you and especially your children are in a safe place. So any more about my part of it from last week, you can go ahead and go on to the podcast from last week, week 4, and check that out. Sherry has a couple things that she's going to go over as her recap from last week as well.
Yep. So the next question that we also covered that was posed to us was whether or not we believe that treatment is effective for offenders, and we certainly do believe that treatment can be effective. And so just kind of like what Jen just said, you can certainly look at our podcast from last week that kind of details, why we feel that way, what types of treatment is available, and why certain treatment is more effective than others. And basically just pointing out that, again, we can't be under the fallacy that offenders are going to be in jail for the rest of their lives. And so treatment is important because we want to make sure that we are, bringing back into the community people that are acknowledging that they have, in fact, committed a crime, that they actually want to change, and that, we're bringing people that are safer and want to be safer in the community, again, around the public and around their family, if they're going to be back around their family again. So and again, you can certainly look at that and take the time to read what we talked about last week during that podcast.
Absolutely. And just to finalize that whole part of our recap from last week, we also talked about the compassionate release due to COVID for inmates. I've still got a lot of questions about that again this week, so please go ahead and check out that podcast, because we did give you a lot of very informative information about compassion release and things that you can do to help yourself in your case in that situation. So feel free to go back and recap that. Well, I just recapped it, but feel free to go back and take a look. Okay, so today we're talking about another very important subject, very dear to my heart. I'm gonna apologize in advance if I happen to get emotional. It's something that it's very important to me, and because I went through it myself and my children went through it, it's hard for me. So today we're talking about the silent victims of domestic violence, and that is the children. And we understand how hard it is to escape from a violent home. And we want you to understand that the children are affected a lot in the same ways that we're affected as adults. Even more so because they're just children, and at that point in their lives, their brains are still developing, and they don't understand necessarily the same coping skills that we have. So we really have to help them a lot in this aspect. As we know, and as we've talked about in our past podcasts, domestic violence is a learned behavior. So for children in a domestic violence home, understand that they're learning the behavior of being nasty, negative, abusive, putting other people down. They're learning that at a very young age when their minds and their bodies are still developing. The children do not process thoughts like we adults do. And it's very confusing them to see a parent at home hurting another parent, and they just, honestly, they don't know how to react. Some children react in a way that is protective of their parent, and other children are in a position that they absolutely don't know what to do, and they just don't want to see anybody get hurt anymore. Children who witness domestic violence between parents are at greater risk for being violent themselves as they become adults. Now, that's very important because we are trying to stop this cycle. So we don't want children to be violent like they've seen their parents be violent for the rest of their lives, for many reasons. I mean, other than the obvious, no one is liked in that situation, and most of them are loners and tend to be on their own and quiet and to themselves because no one else really understands their thought pattern. So we want to try to break that cycle and make it so that, you know, children aren't seeing that kind of abuse in the home. Children in a home where one parent is being abused also tend to feel very fearful. They're very anxious all the time. They never know when that iron is going to strike again. And it's hard enough being an adult in that situation and not knowing when that's going to happen, but then to be a child in that situation is magnified by 10 times because, again, they don't understand what is going on. And I think for us, we tend to think that we're sheltering our children in a sort of way and that they're not seeing or understanding as much as we think they are. This is where I'm going to get into my own personal experience because I tried very hard to make sure that my son saw very little abuse. However, that didn't work, obviously. I couldn't pick and choose when my abuser was going to lash out at me. And 90% of the time, he did it in a way that the children were there, or at least one of my children were there. I personally did not realize the effect that domestic violence in my home had on my children until we were ready to go to court. And it was then that my son came forward with information and things that had happened to me that he had seen or that he had heard that I myself had suppressed for so many years. I mean, in a 13-year of domestic violence, there's so many things that happen that you can't possibly remember everything. And I didn't expect myself to remember everything, but here I was with this child who was a child. And he was recounting some very horrific things that he saw and that he heard that were very disturbing to me because I hadn't realized how much the situation that we were in had affected them. One thing that stands out in my head so much was my son always had a hard time in school, and I never understood it. And actually, when he was very young, he was diagnosed with ADHD, and I swear to God he didn't have ADHD. It just didn't fit who he was. And so I never medicated him. Fast forward to about 10 years later, and actually the right people got their hands on him, and he was diagnosed with trauma. Makes tons more sense to me. But here we are in the beginning stages of school, first grade, and they're all telling me that I should have my son tested because they think he has ADHD. Well, my son didn't have ADHD. Come to find out through the courts and all of our interviews with the assistant district attorney on our case, my son hadn't slept. He would go to bed at night, but because of his father's screaming and because of sometimes hearing me scream because I was being hurt, he wasn't able to sleep at night, which meant that when he went to school the next day, he wasn't functioning in school properly because his little mind, as it's growing and coming into itself in first grade, it wasn't able to process all of this. And he admitted to the assistant district attorney that most nights that he went to bed, he didn't sleep because he was so worried that he was going to wake up in the morning and I was no longer going to be alive. So try to imagine yourself being, a 7-year-old child, 7-year-old to 11 years old, and not getting the proper sleep at night because you're so fearful that you're going to go to sleep and you're going to wake up and your mom is not going to be alive. Now that for me was very, very hard to understand. It was very hard for me to wrap my head around because all this time I saw this boy and he's growing up and I realized he had a hard time in school. But I certainly didn't realize that the reason he was having a hard time in school is because he was trying to protect me. Because every single night he was waiting to make sure that it quieted down before he would go to sleep at night because he was so worried about whether he was going to have a mom tomorrow. So that's very profound. And that's not something that my son ever talked to me about. It was something that came out when we were going to court. And there were so many things that came out at that point that I truly had no idea had affected him, because I didn't see that. I didn't understand the effects that it was having on my son, or both of my sons, as a matter of fact. I didn't see any of that because I was in the situation. And to me, they were just normal kids running around, and they were very happy, you know, outside of academics. And I didn't see all of those signs. So we're trying to help you because we want you to understand those signs. We want you to see that domestic violence, even if your child is not being physically hurt, they are being mentally hurt. And it's just as important because, again, these are small minds that are growing. And the way they're growing and seeing negativity and seeing violence and having all of that fear, my goodness, that is nothing that any child should have to go through. And today, it's honestly, it's one of the things that torments me the most. The fact that my sons have been affected in that aspect. Again, you know, we worked really hard to get them where they are today, and I'm very happy with where we are today, and so are they. Therapies, of course, had a lot to do with that, and that's why we pushed them. But at the same time, I think you have to understand that it has a profound effect on our children. And, you know, recently, one of my sons now is 18 years old. We went for a walk. He's kind of driving me a little bit crazy right now. He likes to do everything he possibly can. And I just looked at him one day and I was like, dude, you got to slow down. You're kind of driving me crazy here. And he just looked at me straight faced and said, Mom, I never had a childhood. This is my childhood. Since we've been away from our whole situation, this is the freest I've ever been to be a child. And I couldn't reply. I had to shut my mouth and say, okay, I get it. And I'm really sorry for that, but I get it. And so no matter what, it's going to have an effect on children. And it's just very important for us all to understand that and to help these silent victims, because if we don't, nobody else is going to. They're just going to get lost in the wind and pushed to the side, and none of the issues that they may have are going to be addressed. So I'm going to hand it over to Sherry now. She's going to talk to you guys a little bit about what we can do.
So I know you said you might get emotional. So, but I don't think anyone could listen to that, honestly, and not feel and what Jen is trying to convey, and not feel what her children and have gone through. And I before I even get into what I have to get into, I want to point out that, you know, when Jen and I do these podcasts, obviously everybody knows we're all separate, right? We can't be together, and so we don't have an opportunity to sit down and work together. And what I find very interesting is that for whatever reason, I don't know how it happens, but we always end up somehow on the same page. And you know, we come up with a topic, or Jen tells me, you know, some questions have come through and we start answering them. But fast forward, my point is this: when I'm talking today about the support, and I'm going to talk about symptoms that you can certainly see in children, Jen just basically outlined for you essentially what I'm going to be talking about today. And what I mean by that is the fact that her child was diagnosed with ADHD, and then she knew that that was not the case. And I'm not here to debate whether or not children obviously are correctly or incorrectly diagnosed with certain you know, mental illnesses and things like that. That's not where I'm going with this. What I want to be clear on today is that there are children who are, however, very much so misdiagnosed with things, because they are symptomatic, and a lot of their symptoms mimic things like ADHD, things like oppositional defiant disorder. And I think it's important for us to know that. And you're not going to know that as a parent necessarily, because that's not your job to know that. But it is our job. And I'm saying this for us professionals to be aware that we need to know the child that we're working with. We need to know histories. We need to get to know them. And we need to be having conversations with this whole family, because we are misdiagnosing children with things that they don't have. We're treating them with medications that they don't need. And we are completely overlooking what's really going on. And so I just needed to say that, because completely separately, I bring that up in my piece without even knowing that Jen was gonna bring that up today. You know, I knew it obviously before we went into this morning or today, but I just wanted to bring that up, that, you know, I'm bringing up my own examples from the clinical piece, but her piece is the real world, and these are the things that are going on all the time. So when I'm saying it, I just want to be clear that, like, it's not just I'm saying it just to say it. Like, it happened, and it does happen, and we need to really be aware of that as teachers, as medical professionals, and as therapists. That misdiagnosis does happen, and we have to be aware of it.
And
So
if I
now,
for
go ahead.
a second, um, you know, honestly, no fault to the doctor that originally diagnosed my son, because at that point, we were living in a violent house. We couldn't talk about that. We weren't able to speak about that. It wasn't until later on when we came forward and we were actually openly talking about what we had been through that the correct diagnosis came about. So the original doctor, you know, I don't know, back in 2007, 2008, he had no idea the life that we were living outside of that office, outside of those standard tests that he was giving him that led him to the diagnosis of ADHD. Anyone at that time that had known my son, even today, he's not hyper at all. The kid doesn't have anything hyper in him. So that's where I knew immediately that this was an incorrect diagnosis. And that's, again, why I chose not to medicate him. I actually reached out to a friend of mine in Texas, and he sent me supplements that helped a lot with focus, because it had, and they were all natural, but they were more targeted towards him staying focused versus giving him a medication that was not going to work for him, because that wasn't what he was suffering from. But again, you know, from a doctor's standpoint, it's hard to make a diagnosis other than that, I'm assuming, because of the similarities. But again, at that time, he was 6 years old and could not sit there and tell a doctor, hey, listen, I'm up all night because my mom's being beat and I can't sleep because I don't know if she's going to be alive. That's not something that a 6-year-old is going to talk about. And so he didn't. Knowing that, of course, you know, there's going to be ramifications if stuff like that was talked about. So I just wanted to interject there, because I didn't want anyone to ever think that, you know, I go against doctors, or I think that people.
No. I don't think anyone thinks that, and I'm not saying that. My purpose of saying it is that sometimes we need to just look deeper than sometimes we do, and the obvious, and we need to just be aware that there are so many symptoms that mimic other diagnoses, and we just need to look into that. And that's where I'm coming from with that, and that it's a whole system that we need to all work together and know that, again, sometimes it's not just this, we're seeing this here, this symptom or these two symptoms, that if we start to really look at all of them and put them all together, that it's usually a lot deeper than that.
Yes.
And so that's where I was, but I agree with you, because you are right. If you can't adequately make a diagnosis when you don't have all the information. So you're right. When you only have this, and this, then it does fit here. But then once you get underneath it, then you can say, okay, maybe it's more than that. And I think part of what I want to just say is that we just need to have that awareness, because I am seeing a lot of adults actually now who have been misdiagnosed as children, and now as I'm working with them, it's much more trauma related than it was things like, again, you know, ADHD and even, you know, oppositional defiant disorder. So thank you for that, Jen. So the clinical piece, you know, just to kind of to mimic, or not to mimic, but to piggyback on what Jen was talking about. So when children and adolescents feel unsafe, they learn that intimidation or violence is an integrated part of intimate relationships, or they start to take on responsibilities for which they are not ready. So part of what Jen was talking about with her son, you know, beginning to take on the responsibility of being the caretaker, or wanting to make sure that his mother was safe, wanting to make sure that, again, not going to sleep at night until, he, in his mind at least, knew that it was okay to go to sleep. Taking on those kind of roles, has a very negative impact on their development. Allowing, excuse me for 1 second, sorry. Allowing them to take a step back. It gives a child time to relearn, and they need to relearn these very important developmental tasks. We must understand that parents have to play a huge role in this treatment. Parents have to play a huge role in explaining the events that have happened. Parents have to play a huge role in treatment. They have to be, as much as the parent obviously also needs treatment and support and counseling, and we understand that, but the child also needs that parent to be there. They are trying to relearn how to trust, and it is very hard. Jen just said, you have a child who, for instance, is having a conversation with a counselor or a doctor, and they're not going to have a conversation about these things that have happened because you don't talk about those things. These are scary things. And so now you're up in front of someone who you don't know, you just met, and if it happens to be the same gender of the person who has been perpetrating these violent acts, this is a very difficult thing. So the parent really needs to be part of this. You need to be working with them to rebuild what it's like to have trust again, what it's like to have a safe and stable home with this person. And it can happen. One of the things that's important to remind everybody is that no matter what, and Jen, again, we obviously, she uses her family as this example, but you can see by her what she tells you every single week that, again, and I've said it too, that there is life on the other side of this, and there is healing that does come from this. So one of the symptoms, some of the key symptoms that I would like to discuss today, and Jen pointed out some of them, is that, as parents, again, as teachers, as medical professionals, again, and as counselors, just things to notice that, again, you may think are symptoms of other diagnosis, but really, again, can fall under this umbrella of a child living in a home who's witnessed domestic violence. So again, sleep difficulties. This includes, refusing to go to sleep at night. This includes also disruptive sleep, nightmares, and that goes along with what Jen said, not wanting to fall asleep for fear that when you wake up the next day, that parent, again, is not going to be there. Somatic complaints, so headaches, stomach aches, other aches and pains that have no medical cause. Increased aggressive behavior and outbursts. So again, modeling the behavior that you've seen at home. And you can do that. It's not just seeing that at school. You also will see that at home. So you can see your child coming home and doing the same things that they've seen. So they're yelling at you, kicking you, berating you, because again, that's what they're used to. Increased activity level and distractibility. So again, these are similar symptoms that you would see with a child diagnosed with ADHD, having a very hard time sitting in class. And so again, we might question, well, why wouldn't it be maybe ADHD? Well, think of it this way. When you are, and we're going to talk about hypervigilance as well, but if you are literally feeling constantly on edge, anxious, paranoid, fearful, even as an adult, it is very hard to feel comfortable in your own skin. And so now you're sitting in class and you're supposed to sit still. You're supposed to focus. There's so many things that you're supposed to be doing. It is very hard for a child who's not only physically feeling it. Okay, so it's not just, we talk about these somatic symptoms, but they at times are physically feeling ill. It does affect them, but their mind is not in school. Their mind is, what is going on at home? Is my mother or father safe? What am I going to walk home to? I want the end of the day to be here because I want to make sure that my mom is okay. And B, I don't want the end of the day to be here because I don't know what I'm going to be walking home to. So there are so many things going on up here in this head for a child to process that they don't know how to process it. And so they're internalizing and internalizing. So just again, things to keep in mind: hypervigilance, which I mentioned. So again, worries, fears, and overreactions to loud noises, or sudden movements, very similar to one who is suffering from post-traumatic stress disorder when we talk about hypervigilance. Regression or loss of learned skills. So you may have an 8-year-old child who suddenly suddenly starts to wet the bed again. That was too much, too many S's. Or your 5-year-old who has been potty trained now for 2 years and all of a sudden is unable to use the potty, and they're just not doing that anymore. You see a lot of regression, withdrawal, loss of interest in friends, in school and different activities. Numbing, literally showing no feelings at all and appearing to just shut down. So again, imagine you are so overwhelmed with thoughts and feelings, you do not know what to do with them. And yes, we have children who can act out. We have children that have the somatic symptoms, but you also have children that it becomes so much that they literally will shut down and have no response to anything. And one of the things that I should have mentioned when I started going through symptoms is, you may have a child that shows none of these, and you may have a child that shows one, and you may have a child that shows all of them. And so I'm not trying to say that to make it more difficult. I'm just trying to point out that, again, not all children fall under these umbrellas, but know this, you have a child that maybe shows to you, you're looking at all of these or, listening to this and think, well, they're not showing any of it. I cautioned myself to say this, but I'm going to say it anyway. You almost want to be even more concerned with the child that literally is showing you nothing.
Agreed.
Because they are internalizing so much, because there is no way, as Jen said, that child has not heard something or seen something that they should not. So it's going someplace.
Mm-hmm.
And the child that's acting out, almost with that child, they're yelling out, they're screaming out for help. They're telling you, I need help. I am hurting and I am seeing things I don't want to see and I don't know what to do with them. But the child that's showing you nothing, again, that's sometimes the one too that wants to fly under the radar because they don't want to pull any attention to themselves from anybody. They don't want to cause problems. Their feeling sometimes is, well, mom has enough going on right now. I don't want her to have to worry about me. So I'm just going to be quiet. I'm going to pretend everything's okay because I don't want to be another problem for her right now. She's got too much going on. So that's just something to keep in mind, okay? That child that's flying under the radar, they have a lot going on too. A big, huge resource, actually, through Boston Medical Center that I want to make sure that I point out today for anyone that is looking for resources, and that goes for any parents, again, professionals, is the Child Witness to Violence Project. I recommend this site for anyone, again, that's looking for trainings, that's looking for resources, information. If you have any questions, this is a great site. I'm so happy that I happened upon it myself. Again, it's the Child Witness to Violence Project. And interestingly enough, for the current times that we are in, this is not just for domestic violence. The Child Witness to Violence Project is for children who witness to domestic violence, so obviously violence in the home, but also community violence. So for anybody that is also currently looking for any resources for the things that we are obviously dealing with right now and have been dealing with and will probably be dealing with in the future, there are some great resources on there. So I just wanted to really, for me, just to quickly wrap up with some ideas on how to support a child who has witnessed violence. So healing begins with relationships. So, we talk about adults in relationships and making sure that, they have the tools and that they have, that they have counselors, that their parents, family members. We've talked about this in the past, that, this is a community, we're talking about a community support system, and that the more positive and loving group of people that they have around them, then the faster the healing begins. Knowing that they have people that love them, people that they can trust, people that are around them that just want to, again, make sure, again, that they have a loving and stable place to grow up and to be, is very important. And to add on to that, knowing that this group also is there for their parent. is also very important. To see that there are people that love and care and that their parent can also trust is also very important. Let them know that it's okay to talk about what has happened. Let them know again that it is safe, that they have a safe place, hopefully more than one, that they can open up, that they can speak, that there's no judgment. I know we've talked about this before when we've talked about survivors, but also with children. They need to know that no one is going to, tell them that they can't talk about these things. No one's going to tell them that they're wrong. No one's going to judge anything that they're saying. No one's going to judge ultimately, as I'm saying this, but what they're feeling. They need to know that whatever they're feeling is okay, that there's no such thing as a wrong feeling in this situation, that they need to be able to say what they need to say, process it, and heal from it, and that there are people there to listen to them.
And you as a parent
Absolutely.
being there to listen,
Yes.
because the strongest thing between my sons and I are the fact that we communicate to each other. We communicate all the time. We still communicate to this day, and we've been free of it for 7-8 years, but we still talk about different things. This way they're getting it all out of them, whatever's been bottled up. It's unfortunate that a good 85% of the memories and the things that my sons talk to me about are all negative. They don't have many very positive experiences that they had with their father, because again, he wasn't just a bad person to me, he was a bad person to basically everybody. So it was a situation where no matter where they were, whether I was present or not, it was a negative, violent situation. Of course, where it came to me is where it affected the kids most, because I was their parent. But open communication between my children and I has been huge. They can talk to me about anything. They, to this day, do talk to me about everything. A lot of it, we earned each other's trust. Okay, when we came out of this situation, and even when we were going through it, we knew that we were the three musketeers. We were a trio. It was us, and then there was him. There was us that were trying to survive and be okay, and then there was him that was hurting us. So I never took anybody else's side besides them. They never took anybody else's side besides me. And therefore, our connection and the fact that, we talk still, I can't even emphasize it enough, still to this day, like we continuously talk about the things that bother us in this situation and the things that we could have changed. And that was huge for myself and my family with my two children, because I didn't want them to feel like they couldn't talk to me about what happened, whether it made me feel absolutely horrible. And believe me, most of the time it does, because there aren't too many positive situations. But at the same time, they knew no matter what, they could come and talk to me. Now, fast forward into our life outside of domestic violence and being away from domestic violence, my son still talks to me about everything. I mean, one gets in trouble at school. I mean, he's calling me before the school even calls me to tell me exactly what he did. And the best part is the kid doesn't lie. He tells me the truth about what he did, because we have that relationship. We have that relationship that they know they can come and talk to me about anything, and that I'm not going to make excuses, and I'm not going to make myself look like a good person if I felt that maybe I could have done something differently at that time. Like, we have very open communication. And I think that it's not only important in this aspect, but understand another very important thing. And that is, in most domestic violence relationships, kids are not, you're completely isolated from your family and friends. So my sons were not allowed to be involved in school activities. My sons were not allowed to be in activities that other people were involved in, because my abuser was so afraid that people were going to start catching on, that he excluded us from everything. So my children and a lot of other children don't have the outlets of being able to get out there in a football field and get out all their aggression and hit a baseball as hard as they can, because they're so pissed off today because of what happened last night at their home. They don't have that ability to exert all of that frustration, because they're not allowed to do it. Because God forbid if Coach Tom sees that you're pretty messed up today and your mom is sitting there in the stands and she's crying or something, like, your abuser doesn't want anybody to see those things. They don't want anyone to intervene with this control and manipulation they've worked so hard at gaining. So we need to be there for our children. as educators, advisors, you need to be there for the children as well, because they don't always have an outlet in which they can get all that aggression out, just like Sherry said. So they're internalizing it, and obviously we know the effects of that. So I just needed to add that in there.
No, please. And I feel like I started going a little bit off on a tangent anyway, so that was fine. I'm glad you brought it back in. And but the last thing I was even going to wrap that up with is just, in general, just being role models. Whomever comes in contact with any kid, it doesn't necessarily have to be a child who, has witnessed domestic violence or violence in their community, but any child. And how to, conflict resolution, and when we're dealing with a situation that's difficult or we don't agree with somebody. And a huge part of this is role modeling and showing that we don't have to all agree on things, but this is how we deal with it. We don't fight, we don't argue, we don't put hands on people, we respect each other, we don't berate each other, we certainly don't degrade each other. And there's ways to do that. And depending on what your role is in a child's life, not only, again, whether it be as an educator, or if you're in the medical field, therapist, family member, again, as a family member, if you're in a relationship, modeling, what does that mean? How to treat your partner. And if you are aware that this is a child who has witnessed domestic violence in their home, then again, continuing to model conflict resolution, continuing to model what it means to be in a respectful relationship with your partner in front of these children, because they need to see that. They need to see that this is the norm. They need to see that this exists, and they need to see that this is something that they can strive for, and that this is something that they can have in their life if that's what they choose to have, in the sense of wanting to be with somebody. So these are just the things to keep in mind. And to be honest with you, when you do look at the list, and if you do decide to go on the website, most of these things are not difficult things to do. They really are basic things that you can do just to support, again, not just a child who's witnessed violence, but any child, that you come in contact with. I think that what's important is to remember that everything that we're doing in front of children, they watch, they take it in like a sponge. And as so much as what Jen has said today, that we don't even realize how much they are really taking in. We can say that we do know, that we understand that children really are, that they're looking at everything, they're listening to everything, but I think we only even acknowledge 50% of that, when really, they spend way more of their time listening and watching and observing what we do, unfortunately more than we do as adults with each other, which is, a sad commentary on things right now, but looks like hopefully we're getting better at it. Jen?
It's the truth, though. I mean, and it is. It's very important to make sure. I said it in one of our last podcasts. One of the most important things that was ever said to me was to surround my sons with love once we got away, and that's what I did. I kept them around people that loved them. I kept them around people that they knew that they could talk to and say certain things, and they weren't going to be judged. That they were going to be respected, and that their feelings were going to be respected, and people were going to try to work with them as best as they can. As far as I'm concerned, and especially with children in school that are affected by this, once you're at a point where you can actually talk about it. I mean, there's not one meeting that comes up with my sons that, if it has something to do with this, that I broach the subject and I do talk about it, because I think it's important for them to not be lumped with everybody else, or to be thought of as a certain way when they're not. And it has helped their education tremendously. You can't be afraid to talk about this. We say it all the time, and you have to be an advocate. You have to be an advocate for yourself. You have to be an advocate for your children. Your children obviously cannot speak for themselves in the way that you can. And if you need a teacher or a resource officer or a guidance counselor to understand your child better because of what's happening at home, and you're in a position where you can talk about it, talk about it. Because by letting them know exactly where your child is coming from, they're going to be able to better fit certain situations with your child. And that's important, because when they're not at home, they're at school. We have two real main places that children are: home and school. And so if we're doing our best at home and school is doing their best, then really our children are blanketed with a lot of love and people who are really there to help them, respect them, and understand the best that they can what that child is going through. So we're going to wrap up today. I hope you guys got a lot of good information from this. I hope that you can utilize something. As always, we really look forward to reading your emails and the comments. It's really great. We love being able to help you guys.
Mhm.
We'll figure out what next week's going to be about based on, what comes into the foundation. And again, we appreciate you guys watching. Love everybody around you. It's again a very difficult time. Make good decisions. And we'll see you all next week. Thanks
Yep.
for watching.
Thank you.